Good afternoon. I'm Congressman George Miller, Chair of the Education and Labor Committee and Co-Chair of the Democratic Policy Committee. And today I'm honored to be joined with Chairman Charles Rangel of the Ways and Means Committee, Chairman Henry Waxman of the Energy and Commerce Committee, Chairman John Dingell, and our respective subcommittee chairs, Pete Stark from the Ways and Means Committee, Frank Pallone from Energy and Commerce, and Rob Anders from the Education and Labor Committee. Today marks a historic moment in America's urgent quest to fix our broken health insurance system. For the past 6 months, our three committees, the committees that have jurisdiction over health care in the House, have worked together in an unprecedented manner to develop and present a health care reform discussion draft for Congress and the American people that embodies President Obama's call for fundamental change in our health care system. President Obama asked us to draft a reform bill that will control cost, guarantee choice, and ensure quality and affordable health care coverage for all Americans. I believe that our draft lives up to those essential principles. Our discussion draft reflects months of hard work and the views of many of our colleagues. We've met with our respective Democratic and Republican committee members, with our Senate colleagues, with the CBO, with the administration, and other stakeholders in an open and collaborative process. To further this open and collaborative process, our three committees will hold hearings on this draft starting next week. After the July 4th district work period, our committees will then work to make refinements to the draft, to vote on it, and send it to the House floor. This is truly exciting news. The House decided to use this unified approach because we recognize that our ability to succeed at health care reform rests in our ability to work together. We know that inside the Beltway turf battles will not advance reform. We believe that in order to change America's health care system, Congress itself must change. When the voters elected Barack Obama president, they did not only send a message to the White House that the White House must change, they sent an equally strong message to the Congress that we must work together for the common good of our nation. They told us that we will not be rewarded for standing on the sidelines or raising every conceivable argument against taking action. Americans will judge us, and rightfully so, by our willingness and our determination to cooperate and to focus on the ultimate and necessary goal of reforming our health care system so that it works not just for a few, but for everyone in our country. That is why the approach that the three of us have taken in this process is one of the key factors that makes this year the year that we will finally fix our broken health care system. The current path of rising health care costs is unsustainable. No one disagrees with that. Health care premiums have spiraled out of control, dealing a crushing blow to families and businesses alike and placing our fiscal future in peril. President Obama is absolutely correct when he says that health care reform is essential to the health of our nation and the strength of our economy. In fact, health care reform is the single greatest tool to reduce runaway budget deficits. Our discussion draft is the first step in building a truly American solution that will reduce costs, offer real choices, and guarantee access to affordable, quality health care for all. In the coming weeks, our committee will continue to seek input from all of the stakeholders, the American people, and members of Congress. We must and we will continue to move forward. If there is one thing that is off the table, it is saying no to health care reform. There is not one child, not one worker, not one employer, nor one taxpayer who can further bear the cost of doing nothing. I am confident that we will have the ability to respond to their needs. And I'd like to thank Speaker Pelosi, Majority Leader Hoyer, the rest of our Democratic leadership, and all of our caucus and all of the members of this Congress for giving us the support and the input that we've needed to develop this uniquely American solution to finally bringing quality, affordable health care to our country. The next speaker will be Chairman Henry Waxman.
Thank you very much. I am Henry Waxman, Chairman of the Energy and Commerce Committee, and I'm pleased to join with my colleagues in our respective committees that will have jurisdiction over this health care matter in presenting a draft proposal from which we would seek further comment by the public and our colleagues as we fashion the legislation. The draft is a very practical one, and it's a uniquely American proposal. It builds on what works and fixes what needs to be fixed. First, we encourage the retention of insurance provided by employers, which is the way most people have their insurance. In other words, as the President has said on many occasions, if you have insurance and you like it, you get to keep it. Secondly, we're going to address difficulties individuals and small businesses face in the current market. Today, people can't get coverage if they have a pre-existing medical condition. Secondly, too many people are charged higher premiums, even if they can get insurance, because of their health status. And small businesses go into a completely dysfunctional insurance market when they try to get insurance for their employees or even for their loved ones. The market's dysfunctional and they face unaffordable rate increases. That kind of discrimination will end. Third, people who don't have employment-based insurance or who change their jobs will always have access to affordable coverage, and they can take it with them wherever they may go, from one job to another. Even if they're out of work, that insurance will be there for them. With that coverage, they'll have the protection from the catastrophic costs that is faced by many who need care and don't have coverage. Choice is the key. Choice is the key for consumers to pick which plan they want, whether it's a private insurance plan or a public insurance plan. Choice is important for patients to be able to pick their own doctors. Fourthly, we're taking comprehensive action to make sure that everyone gets more value for their health care spending. We're moving to get costs under control through payment improvements and delivery reforms. And we're taking a number of steps to improve quality and reduce ethnic and racial disparities. And under this proposal, at least 95% of Americans will be covered, which helps us proceed on both the cost and the quality front. Fifth, we're improving Medicare. People who have Medicare will have that available to them, and they'll even have a better Medicare system. We're going to take substantial steps to phase out the donut hole, that so-called donut hole that people face when their pharmaceutical costs are too great. And we're going to address one of the major concerns of physicians around this country, and that is that we are going to permanently reform the unfair physician payment cuts under current law. We're going to fix the sustainable growth rate, or the SGR. Six, we're making major investments in the workforce, making sure that physicians and nurses and other health providers are available to meet patients' needs. And there is an even stronger network of community health centers that will be available as well. And finally, we're going to enhance prevention and wellness programs. They're absolutely essential to a true health care reform. So we're assuring coverage of preventive benefits and investing in major community prevention initiatives. We are now ready to proceed. This legislation, and I want to stress it, is important for the health and the financial security of all Americans. We're going to seek helpful input from our colleagues, from citizens, from interest groups. We're going to hold the hearings starting next week, and we're going to keep on the schedule that the President set out for us. We are going to be proceeding to figure out a final proposal to present to the House of Representatives by the end of July. Let me be clear, the time to act is now. The one choice we can't make is to just delay, because the status quo is unacceptable. We can keep the status quo, or we can move to a new system. And this new system will be based on the vision of President Obama, the vision he set out in his campaign, the vision for which he had a mandate to move forward, and the vision for which we stand ready to be of assistance to him. We will now hear from Chairman of the Ways and Means Committee, Charlie Rangel.
Thank you, Henry. It's been a real pleasure for me to work with the Chairman of Energy and Commerce and Labor in putting together this plan. It hasn't been easy, but it's been really an educational process for all of us. And to be working in the shadows of John Deagle's dad and recognizing the historic work that he's done over the years in the health reform system just reminds me of how many politicians, members of Congress, and presidents have said that they're going to do something about reforming our health system. And now, for the first time, the president has pulled together all of the stakeholders, all of the people that have fought against this over the years to come together and to recognize that we have to do it for our country, we have to do it for our citizens, we have to do it for our economy, and we have to do it if we're going to remain competitive. Everybody has a story, a horror story, of somebody that was underinsurance, didn't have insurance, didn't know the cost of the insurance. People refuse to leave their jobs because they can't afford to lose their insurance. Bankruptcies, foreclosures, all of these things because of the high cost of health insurance. And where was America? Behind all industrialized countries, paying twice as much for insurance and not getting access, not getting quality. When the committees get together, it's no small task, and we haven't finished our work. But we thought it was important enough to the members that they know what are we thinking about. We've had hearings. Every committee's had a half a dozen hearings, and yet there's still members on the floor that have problems in understanding the difficult decisions that have to be made in modernizing the system and paying for the system. But we thought that America should not have to wait, that we want to get this discussion draft out there. We want to get the maximum support for this so that doctors and health providers would know that we're sending all of these resources out there in order to have a healthier and stronger America. There is no question that we will be saving trillions of dollars in the industry, stopping the hemorrhage that's there, having employers to feel that they can do what they always wanted to do, and that's to give some assurances that their workers would not have to worry about the health or their health or the health coverage for their families. Small employers that wanted to do it but couldn't afford to do it will be provided incentives. Poorer people and working people that are under insurance and have no insurance, that are dependent on emergency rooms, will now know that they can negotiate a health system. And then to have a public health program, an option, so that they're not captive of the large insurance companies, but able to talk with them and compete and say that if you can't give me what I need, I can go to the exchange. I can go there and deal with the people that perhaps would give us a better chance. Is this going to bring down the cost of health insurance? You bet your sweet life. I can't wait to talk to anybody that's fighting against this public health insurance programs. It's going to be competitive. The health information technology is going to force them to provide more options for people. We're sending out there 48 million people that had no insurance, and they will have in their negotiating hands for the insurance companies to compete with subsidies in order to get insurance. Half of the people who've been underinsured will be able to negotiate. So what does that mean? It means providers will be able to know that the government is a friend and a partner of everyone seeking health insurance. And so the industry is going to provide new jobs for the providers, nurses, doctors, primary care doctors, centers, so that communities that never had access to health care would be able to do it. It's going to mean a stronger financial country. It's going to mean a stronger health country. And it's going to be a strong moral standard that we will be setting in order to do what we should have done a long time ago. What an honor it is for me to present to you John Dingell, because I told him this afternoon, his dad has to be looking down on him saying, John, it's just about time. Because for all of the years that he spent in this Congress, he can tell you the numbers of presidents that have said, we're going to do it. But this time, on his watch, the Dingle bill will be coming out, and it's my pleasure to present my mentor to you, John Dingle.
Love you, Charlie. I love you, Charlie, and thank you. Dad, I think, is looking down, smiling, not only on the fact that we're going to do this, but that I'm associated with such wonderful people. And I'm proud to be here with my colleagues and to tell you about how exciting this day is. I've worked 50 years on health care reform, and the release of this discussion draft is the first step towards getting a bill passed this year. What we have come up with is an American solution. Much planning has gone into the discussion drafts that you and the rest of the nation will see today. But now the real work begins, the work of explaining to our colleagues in the Congress and making the proposal available to the American people. We offer greater choice to the American people. People will have the option to choose between plans, to keep that which they have now and to keep their doctor, or to make such changes as they wish as free Americans to do. We will also give the people the choice of a high-quality public health insurance option that will compete fairly and evenly with the private companies, so as to provide a yardstick and a measure for people so that they can know what there is out there that will give them the best choice of health care. On Tuesday, I was a part of a hearing in which Chairman Bart Stupak asked the heads of 3 insurance companies what they would do to stop the terrible practice of rescission, which has left thousands of Americans burdened with costly medical bills despite paying their insurance premiums in the fashion that they are supposed to. And they all said they had no intention of doing that. Rescission is simply where you wait till a guy is sick and then you cancel his policy on him. This is something that's got to stop, along with some of the other abuses, use of non-community rating systems and what they call pre-existing conditions. There will be no rescissions in the public option, and there will be none of the other abuses which we are seeing in the insurance practices that are now offered to the American people. And consumer protections will be established in that option that private companies have so far refused to do. So we're going to create competition, and we're going to create choice, and we're going to see to it that the public option included in this bill will not only see that people are treated fairly and have the option of having the kind of policy that they might want available, public or private, but it will also establish benchmarks regarding fair pricing and drive innovations that will help reduce long-term cost growth. The public option will ensure competition in areas where there are few private plans. The only alternative to this that I see is counting on the insurance companies to fix the problem. Well, they've had 50 years to do it and more, and I can tell you that that's a terrible thought to me. While there may be some differences in opinions on the specifics of the public option, we share the same goal. That is to fix Americans' broken health care system, something which used to be a matter of only humanitarian concern, but now which is a matter of desperate urgency, not just to American businesses who can't afford this anymore, but to the national economy, which is going to go broke doing this. What we're releasing today, I stress, is a discussion draft. And I look forward to working with all parties as we move forward so that we can end up with the best bill possible. And again, I want to repeat how proud I am to be with my colleagues up here. We're going to give the American people what they need, what they deserve, and what they want. A good, practical program of national health care. Thank you.